It's been brought to my attention that this morning at the Turkeyville site, a discussion was started by a woman who had been off for 3 weeks and had been to her doctor and had told her doctor that she'd quit smoking and kind of was expecting some sort of positive reinforcement. And the doctor asked, how long she'd been off, and she said 3 weeks. And the doctor just kind of blew her off. It's like, oh, 3 weeks, that means nothing, doesn't count for nothing. And the woman was taken aback, which most people would be. And some of the discussion that followed was just what a jerk the doctor must be. And, how could he not be making a big deal out of, a 3-week quit? You have to understand, doctors are very skeptical of people being able to quit smoking and being able to stay off over the long term. Good reason why. They keep seeing patients with issues, with medical problems that necessitate that they quit smoking. And then they give these patients over and over again all the best advice that they can, the state-of-the-art treatments. They refer them to this, and they maybe in the beginning push them to, use this. You've got to quit smoking. It's really important. And then they see these people fail over and over and over again. And pretty soon, they just become skeptical about it. Anyone would. If you work with people over and over whose life is on the line and yet they don't quit, again, given the best advice that they can give, and they don't quit, well, you just start to believe that people can't quit smoking. There's a lot of people I know who worked in tobacco control, who ran smoking programs, who burnt out relatively quickly because they kept seeing failure. But again, they kept using state-of-the-art approach. It's all they're taught to do. It's not like when people go into the medical profession that there's whole coursework taught about stopping smoking. We have a string at the Freedom Board. We started up back in 2004, and it was about our new doctors taught recovery. And I'll attach this string into this link here, into the video description. It's a type of thing that doctors get almost no training. The only information they get are from the pharmaceutical companies on how to sell their products. It's nothing concrete about smoking. Doctors understand what smoking causes. They don't understand what causes smoking. Doctors understand how to treat the problems that smoking causes. They don't know how to treat smoking. It's a limitation in what they are taught and what they are told, and it's, in a sense, not their fault. It's the only information they've got. One of my most classic examples of bad physician advice, though, was back in, I think it was like 1978 or 79, when I was doing one of my first clinics at the hospital where I worked. And the advice that was given here was, patient was told by her doctor, she was a cardiac patient, but post heart attack, and the doctor told her, you've got to quit smoking. You're going to die if you don't stop smoking. This is while she's in the hospital after the heart attack. She quits smoking. She doesn't go back. She quits in the hospital. Well, several months after she was out of the hospital, her weight was up, and she went back to the doctor, and she'd gained like 20 pounds. They says, "Oh, this is unacceptable. You can't, you can't carry this extra weight." And he told her, this was the advice that he gave her at the time, if you have to, just try to smoke, 3 cigarettes a day after meals, just to help control your appetite. Smoke 3 cigarettes a day. Well, of course, the woman tried to smoke 3 cigarettes a day, but by the second day, she knew she was full-blown relapsed. She didn't understand why. I mean, she was following doctor advice, but she relapsed. She was up to 2 packs a day again, and she goes for her next appointment, and not lost any weight during this time period. She's still up 20 pounds. She was a 2-pack-a-day smoker again. The doctor, when he found out that she was smoking 2 packs a day, was just so angry with her. He says, "You can't smoke this. This is going to kill you." And he was so disgusted by what she had done, that he said he didn't want her for a patient anymore, and to go find herself another cardiologist. I mean, if she's going to smoke on top of, everything he's done for her, he put her back to smoking. But he didn't understand it. He didn't understand the addiction. Well, nowadays, I would hope that something like that wouldn't happen, that more physicians understand the addiction, but they still don't have a thorough training. This is where I think everybody listening to this who's a former smoker can really make a difference here. Talk to your doctors. Help them understand what you did. You were working with misinformation in all likelihood when you first started thinking about quitting, and you researched something and you found this material and you realized, hey, cold turkey works. Well, if doctors would talk to their former smoking patient, they would see over and over again that the people who quit smoking were cold turkey quitters. And again, there's a really good chance that people going to them for advice to quit smoking, one of the first things they're telling them is, hey, whatever you do, don't go cold turkey. Again, I have a lot of material addressing this issue already. A lot of videos are touching on this issue, and I'll put them into the video description. But try to get your doctors to understand what you pulled off. Not just for your benefit, but for every patient that they encounter after this. They, in many ways, minimize what's going on because, again, they're skeptical of long-term success. But if you're a long-term success, maybe you could start to override some of that skepticism. Help them to see that, hey, quitting is possible. Staying off is possible. Long-term success is very doable. It is an accomplishment that anyone can make. Anyone it is who finally makes and then sticks to a personal commitment to never take another puff.